A warm welcome to this series of video presentations on the role of bisphosphonates in Paget's disease. Now, my name is Stuart Ralston. I'm chairman of the Pagets Association, and we're presenting these interviews in celebration of Paget's Awareness Day, which is on the 11th of January 2021, marking the 207th anniversary of the birth of Sir James Paget. Well, today it's my great pleasure to welcome Linda Fenlon, who's a member of the Pagets Association, and she's very kindly agreed to talk to me about how the condition first presented and her experience with the condition. So, welcome, Linda. So, I gather you were first diagnosed with Paget's in your mid-40s, and I think it would be quite interesting to hear, what your symptoms were, how the symptoms presented, and yeah, how you experienced it.
I had hip pain. But I also had back pain. Years before I'd had problem with discs. So, but the hip pain was getting worse and worse. Because I was overweight, I didn't really want to go and see my GP because I knew I would get shouted at. But in the end, I had to go. And luckily, because I'd not had an x-ray for 5 years, she thought it was referred pain from my back into my hip. But just because I'd not had an x-ray for 5 years, she sent me for an x-ray. And it's the little story is that she sent for me with the results of this x-ray and said to me, Linda, I don't know how to tell you this, so I'll read you the x-ray results. And it was because I'd only had across my pelvis x-rayed, it was Paget's disease, L5S1 and head and neck of right femur. And I, at 44 years old, I sat there being a nurse, a children's nurse, and I sat there and said, Paget's, only old people get Paget's. And she said, no, not strictly. Sent me away. I had to get a sick note from her because I was working as a physio helper in care of the elderly. So it's quite a heavy job. I knew what Paget's was. When I was doing my nursing training, because it was children's nursing, I shouldn't have actually come across Paget's. In the senior block at the end of the second year, I had to go out with a midwife and a district nurse. And with the district nurse, we went to visit this lady who was in a wheelchair, and she did this. She talked about her chalky bones that snapped when she turned over in bed. And I mean, this is 1968, so it is a long time ago, but she had no treatment. She was dying of heart failure, and sat in my GP's, that was me in that wheelchair. So I came out of my GP's, went to the local library to check that Paget's was what I thought it was. And there I found the address of the Pagets Association. Rang them up, had the phone number, rang them up and spoke to Trisha Orton, who said to me, go to Manchester Royal Infirmary to see a consultant called Mike Davis.
Can I just stop you there, Linda? That is very interesting, actually. Well, first of all, it's quite interesting that you kind of knew about Paget's disease just because of your training and you read out about it, and great also to hear that you actually found out about the Pagets Association and got some advice. So you just mentioned there that you got referred to Manchester Royal Infirmary and
yes.
saw Mike Davis, who I remember very well. So what did Professor Davis say? What treatment? What did he explain about the disease, and did he offer any treatment for you?
Yes. First of all, I had a bone scan and discovered that the Paget's was in my skull and T12 as well, which the x-rays hadn't shown up, obviously. He then admitted me to Manchester Royal, and I had some Pagedronate, which was the treatment at the time. Unfortunately, I didn't respond very well to that. I had like a flu-like illness. Even to the extent that where the cannula had gone into my arm, I developed levitis in the vein. So then he said, so only have half a dose the second time. I had to have another dose a month later. But I was okay with that. Within 6 months of seeing Mike, I was back at work. I'd have the bone and the treatment and was back at work.
Brilliant. So basically, although you had the flu-like illness, which is a known side effect, we've heard about that before, actually once you go over that, helped the pain and you obviously improved. That's really great to know. Did the effects of that last long, or did the effects eventually wear off, or did the pain come back? If you could maybe just tell us about that.
It lasted about 2 years. I think probably because I only had a half dose the second time. I don't know. But it lasted about 2 years. I managed to work for another 18 months. But because of the job I had to take early retirement through ill health. Didn't matter because I retrained as a counsellor. So, I still could work. I worked until I was 60. And I think that's what I want to say about Pagets and the treatment, that in 1993 I thought I would be in a wheelchair within no time, and here I am 30 odd years later still on my feet. I suppose there's life after Pagets because of the treatment. There is life after Pagets. Absolutely.
That's very interesting. So you obviously, it helped you a lot. But then I think it did recur. And then did you have further treatment then, or did you decide that was enough? Or tell us what happened then.
Well, unfortunately, Mike Davis retired and a new consultant came along. I don't mean unfortunately. And by which time Zoledronic acid had come along. So I had that. I've had about 5 since 1996. I've had about 5 doses of zoledronic acid, the last one being about 2 years ago, and I have no problems with that.
Okay, so that's interesting. So you said that the Pamidronate lasted a couple of years, then you had a dose of zoledronic acid, and then how long did that last? Did that last a much longer time, and then many years later you had another infusion? I'd just be interested.
The first dose lasted about 5 years. I got complete pain relief.
Yeah.
And then the weird thing is the pain is never as bad as the initial pain.
Yeah.
It never comes back as badly as, sorry, that's not good English, is it? It never comes back as painful as.
That's absolutely fine. So the first dose lasted 5 years. The second, was that also 5 years or not such a long time?
No, it's about 2 or 3. I know it's 2 years since my last one.
Okay.
And I'm kind of getting ready for another dose.
Okay, that's good to hear. So it's obviously made like really a big difference to you, because you were obviously in a bad state, and fantastic. Well, and you're still attending Manchester Royal Infirmary to this day?
No, we moved to the Wirral a year ago. But I'm going to ask my GP to send me to Liverpool.
Yeah, okay. Well, that's one of the Pagets Disease Centres of Excellence, and I'm absolutely certain you'll get top class care there. Yeah. Well, Linda, I'd like to thank you for your time today. It's been brilliant to hear about your story with 2 of the bisphosphonates we've been discussing already in our video presentations, Pamidronate and now zoledronic acid, and especially the very long duration of action that you had with zoledronic acid. So thanks once again. Thanks for helping. And has the Pagets Association been a support to you? I'm interested to hear.
The Pagets Association, I can't praise them enough. Initially, the advice that Tricia gave me, and then eventually when Diana came along, she started these quarterly meetings. With Paget's disease, you know yourself, not a lot of people have even heard of it. And to walk in a room where there are other people with Pagets who know how you feel, know what the pain's like, you don't have to explain to them. And that has been such a support. The other thing is the staff in the office, if I'm just fed up, I can ring up and have a moan, the support is immense. And sounds awful. I'm going to leave them some money because it just, do you know what I mean? It's just, they're fabulous. The association is fabulous.
Thank you very much, Linda. It's so good to hear those words, and I really appreciate your time taken today. So thanks once again.
Nice to talk to you.
Thank you.
I